Hello, Mr. Juarez. My name is Paola, and I will be your nurse today.
Hi, Miss Paola. Nice to meet you.
Likewise, before we get started, I have a couple of questions. Just to confirm, what's your full name, please?
Marcelino Juarez,
What is your date of birth?
February 26, 1950.
Do you have any allergies?
No allergies, but I want to know more about one of my medications. I feel like I'm taking too many. It feels like overkill.
Don't worry, Mr. Juarez. I'm here to answer any questions you may have. You won't leave here today until you feel comfortable with your medication.
Well, first off, what the heck is fluoxetine?
Fluoxetine is a selective serotonin inhibitor, or an SSRI.
Interesting. What is an SSRI?
An SSRI is an antidepressant drug that inhibits the reuptake of serotonin into presynaptic neurons. This then increases serotonin levels in the brain. Serotonin is a chemical that carries messages between nerve cells in the brain and throughout the body. It plays a key role in functions such as mood, sleep, digestion, nausea, wound healing, bone health, blood clotting, and sexual desire.
I didn't realize serotonin does so much. What specifically is fluoxetine used to treat?
It is often used to treat OCD, depression, bulimia, panic disorders. It usually goes under the brand name Prozac and is commonly prescribed as an antidepressant. Fluoxetine has a wide range as a medication that affects serotonin levels. For example, in conditions such as bulimia, an imbalance can increase one's urge to binge and purge. Fluoxetine can be taken to decrease these urges by effectively balancing the neurotransmitters in the brain.
I see. How exactly does this medication work in the body?
It is metabolized or broken down in the liver into active metabolite that has a half-life that ranges from several days to a week or more. The metabolites are primarily eliminated through the urine.
And what exactly is a metabolite?
A metabolite is a substance made or used when the body breaks down food, drugs, or other chemicals.
How often should fluoxetine be taken?
It is taken 1 or 2 times per day with or without food. Typically, when taking fluoxetine, patients begin taking a low dose, which is gradually increased over several weeks.
How long will it take to see results from fluoxetine?
Sleep, energy, or appetite may improve within the first 1 to 2 weeks. Improvement in these physical symptoms can be a meaningful early sign that the medication is working. Depressed mood and lack of interest in activities may need up to 6 to 8 weeks to fully improve.
Oh, are there any side effects associated with fluoxetine?
SSRI can cause GI disturbances, including nausea, diarrhea, dry mouth, and anorexia. SSRIs have been associated with sexual dysfunction, reduced sexual interest, delayed orgasm. The central nervous system side effects include headache, nervousness, insomnia, and tremors.
What can happen if I discontinue the medication?
Sudden discontinuation of SSRI treatment has been associated with discontinuation syndrome. The symptoms of discontinuation syndrome include dizziness, nausea, insomnia, and anxiety. This is why you should definitely not stop taking it.
How can I avoid discontinuation syndrome?
The dosage of SSRI should be gradually reduced over time when treatment is discontinued. That, of course, is for your physician to determine. How do you feel now that you have more information, Mr. Juarez?
I feel so much better. And I know that I should definitely not discontinue any medications, but if I need to, I should slowly reduce the amount when it is determined by my doctor. Also, I know that my medication can cause me to have dry mouth, diarrhea, and vomiting. It's good to know that the nervousness and anxiety I've been feeling are also due to this medication.
It was
Thank
good meeting
you.
with you, Mr. Juarez. Thank you.